Welcome to Run With It, Canada's running fitness and health program. On this month's episode, we have the Sports Doctor is In segment, so stay tuned for that. But first, let's go to my conversation with Kim Vopni, Pelvic Health Specialist. Check this out.
Hi, I'm Christine Blanchette, and joining me on Run With It is a very special guest. She's back, Kim Vopni. She's a pelvic health specialist. She's a vagina coach. She's a certified personal trainer and author. And she's here today to talk about pelvic health awareness and how it can improve your quality of life and more. Welcome back, Kim.
Thank you. Appreciate coming back. Always happy to spend some time with you. Thank you for having me again.
Yeah, I mean, there's so much, we talked about awareness on the show before, but tell us about your role for the audience who have never, maybe didn't see the show or listened to it.
Yeah, I get asked that all the time because people are like, what's a vagina coach? It's not the typical title that you hear, but I became passionate. I shouldn't say passionate. I became fascinated and interested about pelvic health sort of indirectly. I didn't know the term pelvic health, but when I was learning about childbirth, I became very afraid of childbirth because I thought, well, then I'm going to pee my pants and I'm not going to be able to run again. And I'm not going to be able to do all the things that I had loved to do. And so from a very early age, I had this appreciation for a group of muscles I didn't even know about. I didn't know the term pelvic health. I just knew that I wanted to keep it healthy because I saw my mom suffer and I saw my mom stop doing certain activities. And so then when I met my husband, had a baby, I was really determined to have a different story than my mom and started to learn about what I started to learn about, group of muscles. And then I started to apply fitness principles to it because being a personal trainer and paying attention to all the other muscles in the body, why was this group of muscles left out of the conversation? And why in all of my fitness training was it not included? So I started to learn about the pelvic floor and started to apply fitness principles to it, hoping my initial intention was helping women prepare for birth. So using fitness principles to prepare for birth, to recover from birth, retrain, rebuild the core, all that sort of stuff. And then it was looking at, postpartum recovery is sort of overlooked. So I started to focus a little bit on that population and formed a second business called Bellies Inc. And then myself and my business partners were going through perimenopause. And so that was a whole other journey where there was new pelvic health considerations. And we were sort of saying, this is not just a do your Kegels in pregnancy conversation. It's not just a go home and do your Kegels and all of your problems will be fixed. We deserve much more education and information about this really important group of muscles. So my role as the vagina coach is to highlight the importance of what the pelvic floor is, all the jobs that it does, what are the signs and symptoms that happen when it's not working optimally, and then how can we use fitness and lifestyle to help overcome those or potentially even prevent them from happening.
Yes, I mean, you are a trailblazer, a role model, and it's becoming more mainstream. I know we talked about that before, but there's always awareness, there's always education out there. And how are you making changes to bring more awareness? Because some people may not even know the pelvic floor even after giving birth. Is that right?
Yeah. And it's funny because it's now been 19 years that I've been talking about this. So sometimes I think, oh my gosh, I feel like I'm repeating myself and I'm saying the same thing and people know this now already. But every single day I hear from somebody that I've never heard of the pelvic floor. What are Kegel exercises? What's pelvic floor muscle training? And so there still is a lot of work to be done. However, awareness has increased drastically from when I began. And some of the ways that I try to get the word out there, big one is social media. A lot of people are using that to get certain messages out, and Instagram, Facebook, YouTube, even TikTok,
Yes.
and Pinterest. And so definitely leveraging the social media platforms is one component. I do public speaking. I love if somebody puts me in front of a group of women who are eager to learn, that's one of my favorite places to be. So I love public speaking. I teach certification courses to other fitness and movement professionals so that they can help their clients with a lot of the principles that I have learned and used over the years. I've written a few books, and I find some people, they can digest content on social media, but a book is they can just order it on Amazon, or they can go to their local bookstore and pick it up and read. And it's also something they can very easily pay forward to other women in their lives, because part of what moves this conversation forward is people like you who are spreading awareness, people who are sharing books, people who are talking about it with their girlfriends, who get informed and now know what to ask their care providers about. So those are a few of the more common ways that I'm doing it.
Yes. I mean, I remember your first book, Prepare to Push, and you have other ones. So can you tell the audience some of your other books?
Yeah, Prepare to Push was my first. As I said, I started out with very much the intention of, if we could introduce the concept and the conversation around pelvic health before one of the major contributors to pelvic floor dysfunction, which is pregnancy and childbirth, then I feel like we could start to change the landscape with regards to pelvic floor dysfunction. So Prepare to Push was meant to help women understand what the pelvic floor is, what the core is, all the changes that happen in pregnancy, how we can mitigate those birth positions that may be better for the pelvic floor, how we can recover more optimally, and basically make it so we're trying to reduce the likelihood of pelvic floor dysfunction from birth. We can't 100% prevent it. There's so many factors to consider, but can we mitigate some of those risks? And then, as I mentioned, we started Bellies Inc. And when we were, my two partners and I in that business, we started presenting at fitness conferences. And there's a really well-known publisher of anatomy, physiology textbooks specific to fitness, but other professions, called Human Kinetics. And they approached us and asked us to write a book called Pregnancy Fitness, because they had a very outdated prenatal fitness book. So that was the second book that was co-authored with my two business partners. And then just before the pandemic, so we didn't even know really about the pandemic, but I had been approached by a publisher in the UK to write a book specific to the pelvic floor and all the different life cycles. And I had written a very small ebook almost, called The Inside Story, and they wanted it to really be an expansion of that. And so during the pandemic, I wrote another book called Your Pelvic Floor. And that one is, again, introducing what the pelvic floor is, how it works, all of its jobs, what are the more common signs and symptoms, and what can we do about it through all the different life stages that we go through.
Yes, it's wonderful. Another book coming out, though? Kim?
No more books. I won't say never, but no, not anything anytime soon.
Yeah, no, that's wonderful. And also, too, you have a movement, and you're so passionate about what you do, and you've been doing it for 19 years, correct? And is it, I think we talked about this before, but having a prescription from your doctor that to go see a pelvic floor specialist.
Mm-hmm. You actually don't need a prescription. And it is my hope that somewhere in my lifetime, the government will actually pay for pelvic floor physical therapy, even if it was to start with just women who are pregnant, but really all women. All women would benefit from seeing a pelvic floor physical therapist once a year, just like we see the dentist. So we can book on our own. We do not need a prescription to see a pelvic floor physical therapist. That being said, if you have a benefits plan, extended health, that requires a prescription in order for your physiotherapy benefits to be covered, then yes, you would need that. But I would talk to your extended healthcare plan first. If they require it, yes, then see your doctor. If they don't, then go ahead. And we've got many amazing practitioners all here in the Lower Mainland, but obviously across Canada. They're all over the world, really. And I think it's one of the most underused women's health resources that we have. And it could prevent so many of the issues and save our healthcare system. I don't know an exact term, but I'm going to say probably billions of dollars.
Yes, no, that's great information. And what are some of the concerns that you get asked and to help?
Yeah, so I guess the two most common, one is incontinence. So incontinence is the loss of urine, involuntary loss of urine. So if we are not sitting on the toilet and urine is coming out of us with a laugh, cough, sneeze, jump, run, some sort of exertion, that is called stress urinary incontinence. So some sort of exertion is creating a rise in pressure, and our pelvic floor and muscles, our sphincter muscles, can't respond appropriately to that load, to that increase in pressure. So they either don't react in time or they don't react with enough force. Maybe it's the two of those combined. And so a little bit of urine will leak out with that exertion. And that's where the pad companies come in, and they send us messages that it's just part of being a woman, and that's just what happens when you get older. And while it's very common and there's lots of contributing factors to it, I absolutely do not believe that we should accept that pads are just something we need to think is our destiny as we get older. The amount of money we spend on pads, I did the math. Somebody who's spending, if they're wearing even just one single pad a day, and most people who are wearing pads are wearing multiple pads a day, but if it was just one single pad a day for a month, and if we spread that over their lifetime, which most people are usually somewhere between 30 and 40 starting to wear pads on a regular basis, if they're not addressing that and they do it for the rest of their life, that's like somewhere between $40,000 and $70,000 on pads. And then not to mention the cost to the environment. So a big message I have is that that's very, very treatable, very, very treatable. You do not need to wear pads for the rest of your life. So huge money savings, lifestyle savings, freedom, confidence, you can get all of that back and maintain it. Urge incontinence is where people have sudden overwhelming urges to go to the bathroom and they feel like they can't make it in time and they're rushing and they're crossing their legs. Sometimes they might leak a little. Sometimes they might have a complete release of their bladder. And this is sometimes a piece of or a portion of it is muscle related, so fitness related. Sometimes it's more to do with behaviors and bladder irritants and things that we have unknowingly done that create habits. So our bladder is starting to signal us when it doesn't really need to. It could be stress, it could be tight muscles, it could be bladder irritants, it could be poor hydration, it could be constipation, it could be low estrogen. So as we get into that perimenopause, menopause phase, we have this additional layer of hormone change. And then we have pelvic organ prolapse. So the two biggest buckets are the incontinence piece and prolapse. And prolapse is where the bladder, the uterus, and or the rectum can shift out of their proper anatomical position and start to descend into or bulge into the vagina. And early stage prolapse can really be asymptomatic, and a lot of people don't know they have it. And this is another reason why I think pelvic floor physical therapy is so important, because we can screen for things like that and catch them before they become more advanced. More advanced is symptoms might be back pain, heaviness, pressure in the pelvis, difficulty with insertion, and that could be fingers, toys, penis, tampons, menstrual cups, or maybe like tampons or menstrual cups may get pushed out. Difficulty starting the flow of urine, difficulty emptying the bladder or the rectum. Those are the most common. People might see or feel a bulge close to the opening of their vagina. And this is more common than incontinence statistically, definitely not screened for or talked about. And it is the one that I say has the biggest mental health toll. It's the one that really halts people in their tracks because they're often told not to run or jump or lift anything. They think they can't exercise anymore. They often stop exercising because they don't want to make things worse. But that in and of itself doesn't help the prolapse, and it certainly increases other risk factors by not exercising. So it's kind of and I've experienced prolapse myself, and it's kind of got this little part of my heart where I really, really want to help get more awareness about that.
Yes, and I want to say I've saw your post on social media, and it's okay to be vulnerable, like to talk about it, because sometimes maybe women don't feel that it's a safe space, but it is. The services you provide. So getting it out there like you are, doing it so well, is going to encourage women to improve their quality of life. So
yeah, I hope so. I certainly share a lot of things I never ever thought I would say in public, but But I think it's important to show people that it happens to the majority. 50% of us will experience some sort of prolapse at some point in our life. And the more we talk and understand and see real people and real ways of helping and moving past that diagnosis can be helpful. So we feel like we're not alone, because it can be a really isolating feeling when you think you are the only one, or you're told that, oh, that's just what happens. And now you can't lift and you can't run and you can't do all the things that you love for your mental health and for your heart health and for your bone health. And right. So, so I'm so appreciative of people like you who are helping get the message out and helping other people. Maybe this is the first time they've even heard of this, where they might have been struggling with these symptoms for years.
Yes, no, Kim, that's just wonderful information, as I said. And so tell us your services. What services do you provide?
Well, the kind of back to what I said is that at the beginning this is, to quote a good friend of mine who's a urogynecologist, this is a fitness issue. So he is a surgeon, and he was performing multiple pelvic floor surgeries and said, this person's back on my table. I'm a really good surgeon. Why are they back here? What has failed? Is it my surgery? Is it what is it? And he said, really, it's the lifestyle. We haven't addressed root causes, and fitness is a missing link. And a lot of people don't train for their surgery. A lot of people don't recover, and even are told, well, now you don't have to do pelvic floor exercise and Kegels because I've just fixed the problem for you. That's what they may hear from a surgeon. And I wholeheartedly disagree. I think we should be training for our surgery, preparing the body for our surgery, like we prepare for birth, like we prepare for a marathon, and set ourselves up for an optimal recovery. And I argue we need that pelvic floor exercise even more, because we now have had a change to that landscape, some scar tissue that can influence blood flow, circulation, muscle function. So we need to, we have extra kind of risk factors working against us now, having had that surgery. It has improved some of this, maybe even reduced the symptoms, maybe has improved some of our function and our organ position, what have you. But we still have to make sure we have our bowels optimized. We have to make sure we aren't, consuming a lot of bladder irritants. We have to stay hydrated. We have to do our exercise. So just like we go to the dentist and we brush our teeth and we floss and we see them once or twice a year, if we get a clean bill of health, we don't stop brushing and flossing. We carry on and we go back and see them. So the same thing applies to the pelvic floor. And that's where I offer I have a membership called the Buff Muff membership, and that's where people get access to education, exercise, lifestyle, meal plans, kind of a holistic approach to how we can optimize our pelvic health, and then progress people through the principles of fitness, just like we do with any other fitness plan. If we want to get stronger, we need to impart loads that are more demanding. So more sets, more reps, more resistance, different planes of motion, mobility, like all the principles that we think of in all the other fitness programs out there for the rest of our body, we can apply to the pelvic floor so that we have resilience and capacity for life, for life, right? Just for lifting a suitcase into the overhead bin in an airplane if we are traveling during our retirement. We want to be able to do that. And if we stop doing certain movements because of our pelvic floor, we end up becoming less mobile, less resilient, less capable. We have more frailty in our bones and our muscles. So the pelvic floor is so central to improving and increasing our overall longevity. So it's really a passion of mine to keep people moving and moving in ways that optimizes their pelvic floor, not hinders it, and helps them get their joy back, because pelvic floor dysfunction can really rob a lot of people of their joy.
Yes, I mean, it's really important, the information you're giving. And tell us about the Buff Muff Challenge.
Yeah, so part of people can start out with the basic, it's called the Buff Muff method. So that's where it's an introductory program. You learn the basics of posture and breathing and how the pelvic floor is part of the core and how you connect with it and activate it and layer it into movement. We talk about constipation. So it's a lot of information, even though it's an introductory program. And included in that introductory program, once you've gone through those basics and you've practiced a little bit, you move to the next step, which is a 28-day Buff Muff challenge. And that is, everybody loves a challenge, right? And I wanted to create something that's started to implement a habit. It's 10 minutes a day, but it's whole body. So it's whole body resistance training that is optimizing the pelvic floor. So it's not just, okay, today you're going to sit and do 150 Kegels, and then tomorrow you're going to do 160 Kegels. And I'm not progressing people through a Kegel practice per se, but we are harnessing the role of the pelvic floor as part of the core, as part of its role in our stability, as part of the role with our breath. And we are bringing it into movements that load our bones and our joints and work our muscles and build capacity, so that at the end we have better pelvic floor control. We have the reaction time dialed in. We have the strength, the sphincter closure dialed in. We have more support for our organs. And we also have more mobility in all of the other joints and more strength in all of our other joints. So we're stronger for life, really, at the end of the day.
Yes. Kim, what do you love most?
I love when people I like the light bulb moments that people have, the comments I get from people that there can be a little bit of frustration and resentment, because they can also usually in saying, oh my gosh, this is the first time I learned this, or this has made such a difference for me. But there's also, why didn't anybody tell me about this before? Right? So there's a little bit of that. But when people share, a big one is women sleeping through the night. So many people are waking multiple times a night to pee. And they're just accepting it. And they're probably even told, well, you're just getting older. And that is BS. We should be able to sleep through the night. Maybe after age 65, you could accept one time. But even then, if we are waking multiple times a night to pee, we are losing valuable quality sleep that is indirectly then not improving your pelvic floor function, interfering with brain function, like all the other detrimental health effects by not sleeping. So getting people to be able to go the whole night without waking to pee is monumental, is life-changing for them. So that's one of my favorite comments that I get.
Oh, it's just valuable information, Kim. I just can't say enough. But what is next for you?
Well, I have partnered up with a fellow who his wife just gave birth to their second child. And he has indirectly become very passionate about helping me get this message out and creating kind of next level. So a Buff Muff level 2. And we're also developing a product line of supplements that can help pelvic floor function. And there's a lot of supplement companies out there. And I don't want to just create another line of protein powders and that kind of thing. So these are going to be really kind of targeted, proven supplements that can help augment. So it's not going to replace healthy eating. It's not going to replace pelvic floor exercise. It's not going to replace hormones, but it's something that it's just another kind of layer that we can use to help leverage our biology for better function.
Well, I'll have to have you come back, Kim. I mean, you're always, as I said at the beginning, you're a trailblazer, you're a role model, but is there anything else you'd like to add?
I think one thing I usually leave people with is the message that it's never too late. I came from a place of wanting to help people prevent. And now the majority of the women that I support are they already have an issue. And I would say symptoms are motivators. Problems are motivators. We want to overcome, we want to fix that problem. And a lot of people say, I get messages daily, well, I've already had a hysterectomy. I've had 4 babies. I'm post-menopause by 10 years. Will this still help me? 1,000% yes. It might take a little bit longer. There may be a few more layers to the onion that we need to uncover there, but it is absolutely never too late. I have one woman in my program who is 92, who is making change in her symptoms. She's 92. Like, that's just remarkable to me. So never too late.
Never too late. And on that note, for people who would like to reach out to you, can you give your website and your socials?
If you put Vagina Coach into Google, you'll find me somewhere. Vaginacoach.com is my website. And social media, all of my channels are at Vagina Coach.
Yes. Thank you so much for being a guest today. And as I said, I'd like you to come back. I would love you to come back, I should say.
I would love to join you again. Thank you very much for the invitation.
Joining me today is Dr. Bob Weil, known as Dr. Bob, who is a respected sports podiatrist and radio host of The Sports Doctor. He's back on the show to talk about running and sports shoes. Welcome back, Dr. Bob.
Always great to see you, Christine. You know, it's great that look forward to the eclipse in a couple of days. You know, there's something special going on. Today we have a quickie segment, and I wanted to give some pearls for our viewers and listeners regarding the whole world of running shoes or sports shoes. And the first pearl is, if you've got a history of problems, foot problems, see podiatry and get them in the mix to help you choose the best shoe for you, as well as to identify your foot mechanics and what can be done. Are you a great candidate for orthotics, etc.? That's the first pearl. The second one is make sure you're fit properly. It's amazing. 40% of our population isn't fit properly. Either you assume you're the size you were. Especially after pregnancy is a great example where the shoe size might change for women. So we want to make sure that you fit properly. And just assuming with sizing many times is a popular thing that's left out. The other pearl again is stick with what works for you. If you have shoes that are comfortable, that you like, then because today there's a new shoe every week. There's a new idea every week, from barefoot to more shoe, less shoes. So if you have something that works for you, stick with it. And then my last pearl is less isn't necessarily better, everybody. There's a lot of hoopla, again, from running barefoot to lighter, less supportive shoes. And the reality is, overall, that's not a smart move. If you're a runner that's had a great history with no problems, you want to go lighter and lighter, I'm not going to argue with you. All other sports, by the way, that require movement, a running shoe is not for you. You want a cross trainer, or ideally you want to choose, like pickleball or tennis or soccer, you want to pick a shoe that's designed for the sport.
Thanks for watching. If you have a question or comment about today's episode, go to our website, which is runwithit.ca. Until next time, run with it. Run With It is sponsored by Mallory's Fashion Network, the Rio Theater, Craft Hair Academy, and Kim Vopni, Pelvic Health Specialist.